Healthcare for the homeless, for me, starts with dignity and respect, and figuring out how we as a team can really promote wellness across the board, whether that be for medical care, behavioral health, substance use disorder, spiritual care as well, breaking down barriers to treatment and to resources, and really doing it from a person-first human perspective, and building strong relationships with individuals.
We really look at the whole person health, and by that I mean we are looking not only at the medical factors but behavioral health factors, and then any of the SDOH factors that go into somebody's overall health picture.
A community health worker is very important in a program for the homeless because they are there as peer supports. They are there to provide that navigation that the patient may need. Some persons need to access resources. It might be as just simple form to fill out. It might be a call and the person cannot access or don't know how to do it, so the community health worker guides the person along that path. They don't take over. They advocate for them. They support them to achieve their goals.
The whole idea is that to keep the relationship, to keep reaching out, to keep developing that sense of trust. So many of our patients reject the healthcare system because they've been rejected by the healthcare system over and over and over again with the traditional models that we have for providing care. So it really takes a lot of effort to develop that level of trust, and that's what our staff do just in a magnificent way. We're extremely excited. This fall we have inaugurated our first official medical respite program. Medical respite is a model of recuperative care, in particular working with populations experiencing homelessness. So people who are too sick to be in the shelter, but they're not sick enough to be in the hospital. That's the purpose that medical respite is trying to fill.
Medical respite is not a new concept. It's been around for a long time. Duffy's excited to have the first medical respite on the Cape, but it really is an opportunity for a patient who was discharged from the hospital to be admitted to the respite, have access to all of Duffy's services, primary care, nursing, case management, substance use disorder support and treatment, while giving them time to find housing, get their chronic diseases under better control, all while recovering after a hospitalization or an ED visit. I think medical respite is incredibly important. If you stop and think about the last time you weren't feeling well or you were in the hospital, and having a safe place to go afterwards to do the things that your providers want you to do. Maybe it's physical therapy. Maybe it's having just bed rest. Maybe it's having access to healthy foods that will speed your recovery. You can imagine our unsheltered homeless patient population has incredible challenges doing that.
From the streets, I think that it was around when I started at Duffy about 13 years ago. I remember hearing about it. Until about 2018, I became aware that we were working with the Barnstable Police Department. We had about $30,000 to work with, and we were putting folks in hotels during winter storms. At that time, most individuals who knocked on our local shelter's door were able to be accommodated, and they had a safe place to sleep. So moving forward, when the pandemic became a reality for Cape Cod, we received, Duffy Health Center received money from Cape Cod Healthcare to put people, to place people in hotels who needed to quarantine when they were COVID positive.
Over the past 3 years, based on our experience through COVID, we really caught the attention of the state, of the Office of Health and Human Services, saw the work that we were doing down here, and invited us to apply to become sort of a regular part of that winter sheltering service system through our In From the Streets program. So a program that was a little $50,000, $60,000 program for many, many years is now over $500,000 and provides thousands of nights of service to individuals who are unsheltered across the Cape every winter.
We open when it's 32 degrees or below, when it's dangerous for someone to be sleeping outside. So we let our community partners know, and the point is to keep people safe and out of dangerous weather, and then hopefully also ultimately connect them to improving their lives, either services that they might need, maybe getting them to a higher level of care if that's needed, and ultimately housing.
So the Reach Van is our new mobile outreach unit. The unit is an RV, as you can see. It has a shower unit on it, and it provides basic needs and community supports throughout Barnstable County. We can provide showers, toiletries, harm reduction supplies, so Narcan, fentanyl test strips, and supportive services. So there's a post-overdose harm reductionist on the vehicle that can assist individuals' access to treatment and harm reduction work. There is an outreach case manager to look at housing and access to healthcare, whether that be at Duffy or in any other facility on Cape Cod. We can also provide on-the-go mobile access to telehealth for MOUD, so Suboxone, Vivitrol, and really just connecting folks to community resources in linkage to care. So meeting people where they're at in the community, breaking down the barrier of the brick and mortar, and really assessing the needs of the community and being boots on the ground.
I think Duffy means a lot to the Cape Cod community. I think it means perhaps more than a lot of people think. Duffy is there for our least advantaged neighbors. These are all folks that are from the Cape, that live on the Cape, that we see on a daily basis. And Duffy offers those individuals a voice in the community that they might not already have.
Persons see Duffy as a place of hope, where you have compassionate, patient, and advocates who help patients and clients to meet their needs and achieve their goals. Many persons might look at some of these as something trivial, but to a patient or a client of Duffy, just to get a simple shower, just to get help to fill a form, it means the world to them.
We're there when no one else is sometimes. We're the people that they call. And also, it's easy to think that Cape Cod is a playground. I grew up here, and for a long, long time, I heard there are homeless on Cape Cod. I don't hear that anymore because Duffy and so many other agencies have reached out and said, look, we need help from you so that we can help these folks and hopefully change a life or two.
People in the community depend on us. Just think about 100 staff, a $13 million organization, and if we weren't here providing the services that we are providing, what a huge hole would be left here in Hyannis, all across Cape Cod.